thank you very much for your time this evening, and also for David for his time with relation to giving us an update on the coronavirus and what it might all mean for us. Just a reminder that you have the ability to ask any question that you wish depending on which device you're using. If you're on a tablet, like I am right now, your Q&A box is in the top sort of right-hand side. If you're on a PC, your Q&A box will be at the bottom in the middle. So please do encourage you to submit questions, and David will look forward to answering them in just a moment. So David, can I pass over to you? Nope, you're muted, Dave, by the way. Sorry.
There we go. Sorry about that. Thanks very much, Paul, and good evening, everybody. It's great to see everybody again. I'm just going to share my screen with you and give you an update, as usual, on the state of the pandemic and the epidemic in Australia. And it's quite an amazing situation that we find ourselves. And it's not all good news, despite what we might be hearing in some aspects of the press. So I think it's a very important update this week. And it's amazing, isn't it, how much changes every week. Here's the latest epidemic curve. I've shared this with you at each update so far. It tells its own story. And as you all know, I'm sure from the mainstream news, the number of cases in Australia now is falling very, very rapidly. I think New South Wales in the last 24 hours was 6, Victoria was 1, and Queensland 0, something like that. And several states now are having 0 cases regularly. So it's clear that in many ways the epidemic in Australia at this stage is very, very much under control. This, I think, is a really interesting graph. This shows the different source of cases in Australia. The red line is the overseas line, for example. You can see how back in late March, most of the cases were from overseas. Now, of course, very, very few are, because there are very few people coming into Australia. You have to be Australian to come into Australia now, and everybody goes into mandatory quarantine. So the numbers are very small, and we don't really mind if there are any, because they will all become cured as effectively in quarantine. What is really important here is the blue line. This is the local unknown cases, and these are the cases that worry the public health authorities, because these are the cases that are community transmission. At the moment, those numbers are very low indeed. There are still many cases, the grey line, under investigation, and we would expect some of those to become blue in coming days. But nevertheless, the reality is now New South Wales has about half of all Australia's cases. Almost all of the cases in New South Wales at the moment are still either from cruise ships or in 1 or 2 aged care facilities that have significant outbreaks. So there is really, really little community transmission of COVID-19 in Australia now. Here, I've shown this curve before. Here it is updated. You can see here the curve is well and truly flattened. So everything that has been done in Australia has indeed flattened the curve, as the Prime Minister has said, and the Health Minister, Greg Hunt, have been saying. I've not shown before the number of deaths. This is a daily death count. You can see the numbers are tiny, compared to what we're all seeing in the United States, in the United Kingdom, Italy, Spain, many other countries, where the daily death count, as you all know, is in the hundreds and indeed few thousands in some countries. Our daily death count is at the moment 1, 2, or 3, which is completely different, of course. And we can expect this number to keep falling now. As the number of cases falls, the number of people in hospital is falling, obviously. The number of people in ICU is falling, and the number of people on ventilators. is falling. And indeed, the Victorian Premier made it clear this afternoon that he does not expect to have to use the thousands of ICU beds that have been made ready for the COVID epidemic. This is an interesting slide. I've shown a version of this before. This is a log scale on the left-hand side. So remember that means the gap between the gray lines here is 10 times the difference. So this is 10,000, this is 100,000. So this shows exponential growth here. And you can see Australia has flattened the curve. And unless something weird and dramatic happens, this is kind of where we'll stay. New Zealand has done the same. Oh, sorry. And many of you will know that today New Zealand announced that next week they will change their restrictions from the current level 4 to level 3, which is where we currently are. You can see essentially that Taiwan has essentially done the same thing as us, and South Korea has also done the same thing and has been flat even longer. And just over the last few days, over the weekend, South Korea has started a quite rapid reopening of its society. And Paul and I would be interested because they've opened the golf courses, and apparently the golf courses were packed. So there you go, life returning to normal in South Korea. Of course, the US is in a terrible situation. The UK is also in a terrible situation. Italy continues to struggle. And it's very unfortunate what's happening in Japan and Singapore. Singapore has a particular situation with many migrant workers who are living in dormitories have become infected. And so there is an outbreak in a particular group in Singapore. And no doubt they will bring that under control. Now, the hot topics here that I thought it was worth raising is how long will our restrictions go on for? Well, the Prime Minister has said, or last week he said 4 weeks, so we've got 3 to 4 weeks to go. Greg Hunter said the same thing. He's also indicated that National Cabinet this week will certainly start to lift the restrictions on elective surgery and IVF. And the reason for that is the hospitals are empty, ICUs are empty. There is lots of PPE or enough PPE available now for it to start to be used on elective surgery. And that's the first step in really trying to bring aspects of Australian life back. Different premiers are saying different things. The Premier in New South Wales, Gladys Berejiklian, has been for about a week now making it very clear that she sees restrictions ending soon or being relaxed soon as numbers stay down. She has always been very keen that schools reopen, and they will start to reopen in the third week of term 2 here in New South Wales. The different premiers are taking slightly different tacks on all of this, but I think it's fair to say that we will be living as we are now for the next 3 weeks. They clearly will watch what happens in New Zealand. New Zealand will go to level 3 on Tuesday next week for 2 weeks. And if all goes well, they will go to level 2. So clearly Australia will watch that very, very closely. And that relates to, what is the plan? The plan, Australia has now made clear, the plan is real suppression of COVID. Elimination may follow by chance, as it were, but the strategy, the official strategy, is suppression and effective elimination. Now, there's a real. This is sort of my point earlier about bad news. Is there's a lot of discussion and debate occurring now, as many of you will have heard about, has it all been worth it? Is the cost worth it? And the point I would make here, when you read what's happening around the world, and I think this is relevant to us as individuals living our lives, but also as doctors and nurses and administrators in general practice and skin cancer clinics. And I share this with you as a very, my senior role in a university. Our view is there is massive uncertainty around what the future holds. So what do I mean by that? Well, it looks like Australia has got on top of this. And unless we do something horribly stupid and horribly wrong, we will not have a COVID-19 epidemic in Australia. Same as New Zealand, South Korea, as I showed you. I'm sure Singapore will get on top of things, etc. But look at what's happening in the rest of the world, and nobody knows when it's going to stop. And nobody knows if it will all come back again. And nobody knows if this virus will become endemic or whether this will happen, you know, in some form every year. This is completely unprecedented, and there is massive uncertainty. So it's very difficult to see how Australia will open its borders this year. Very difficult to see how anybody would be allowed into Australia this year because of the risk of importing COVID. So massive uncertainty. I think what this means for the health system and for primary care, for skin cancer clinics, general practice clinics, is what a lot of us are already thinking about is if you like, a new normal model, that there isn't necessarily at all going back to how things used to be, but thinking, for example, about how do we fully integrate telehealth into our models of care? How do we maybe set up special days or half days for the elderly? There is a lot of talk in the UK at the moment about opening up their economy, but keeping the elderly restricted in their movements. Now, the elderly, as we know, are by far and away the most vulnerable to COVID. So if something like that happened in Australia, is there a way that we can pay special care to the elderly? Now, in general practice and in skin cancer, most of our patients are elderly. So thinking about how we maintain our current models about PPE, social distancing, extreme cleanliness, etc., it is really interesting. And I think we're certainly doing this in the university and in the university hospital, is very actively, even aggressively planning for what a new normal might look like. We are not expecting that we will go back to the way things were. So something to think about. The last thing I just wanted to share with colleagues is some really interesting information around asymptomatic carriage. And this has been contentious right from the start of the epidemic, and we've talked about this each week as we've done updates. And the truth is, we still don't really know what the answer to this is, but there is some really interesting data coming out now. We've all known of the Ruby Princess, and if you look at the data coming out of the Ruby Princess cruise ship, we have two groups, crew and passengers. The crew tend to be young, fit and healthy, and the passengers tend to be old and comorbid. Now, if you look at the data, and I've updated all of this today, of the 1,100 crew, 202 have tested COVID positive. That's 20%. There have been no deaths, 12 are in hospital. That's young people, relatively fit, relatively young people. Amongst the passengers, there were 2,600 passengers. 600 became infected, that's 25%, and 21 are dead. That tells us the whole story about youth, the young people being not getting very severe illness with COVID. But notice how many of them are infected. 20% of the crew were infected. Now, many of you will have heard of the Theodore Roosevelt US warship. They've had a COVID outbreak. There were 4,800 crew on that ship. Of course, they're all relatively young, pretty fit men and women. 660 became infected. That's 14%. 350 of them, call it half, were completely asymptomatic. Young people are getting infected in particular circumstances when they are crowded together, and lots of them are asymptomatic. You have to assume the asymptomatic people are transmitting the disease. The same has happened on the Charles de Gaulle French warship. 1,700 crew on that ship, 1,000 cases on that ship, 60% of the crew infected, only one of them ill enough to go into ICU, half of them asymptomatic. So a lot of interesting information there that again makes clear the difference between young people and old people in terms of severity of illness, but also makes it very clear that certainly in circumstances of crowding, a lot of asymptomatic infection occurs. Now, what that means is there are many seroprevalence surveys underway at the moment around the world, where in different countries, properly designed studies are doing blood testing to look at the prevalence of COVID in the population. We don't have the answers to those studies yet. They'll start to come out quite soon. It's going to be really interesting to see what the prevalence is in, for example, the UK, where there's clearly massive numbers of people with COVID, massive numbers being sick and massive numbers dying. Some people are proposing that herd immunity is likely to follow in the UK, 60% of the population infected. That's the hypothesis. It needs to be tested. What we can say in Australia is because so much testing has been done, nearly 500,000 tests now, and the positivity rate is less than 2%. So there's very little COVID in Australia. All of that has enormous implications for vaccine development, questions about if you've had COVID, do you remain immune? Nobody knows the answer to that yet. And the true role of asymptomatics in transmission is still not known. So that's my update for this week. I hope that's useful to colleagues. I'm very happy to try and deal with Q&As, Paul.
Yep, definitely. I've got one. But just a quick question to you around testing, because obviously there's the swab test, which is obviously used to find out whether you've got it, and they can now do a blood test, which takes seconds. I mean, do we reasonably foresee, let's say for travel, right? Because that's, once again, me living in Singapore, that's obviously a big issue. I'd like to be able to come back to Australia at some point. And just to share that today, the government actually announced there were 1,426 new cases in the last 24 hours, of which of those only 16 were local community-based. That's all in the foreign workers you shared. I think we've had something like 2.5, almost 3,000 in the last 4 days, which is obviously not good. But what I was just conscious of is that is it reasonably foreseeable, as I know there's obviously new tests that have been developed in China, et cetera, and just from the testing regime, is it possible potentially you could land in a country and then the government tests you as you arrive, not having to go into 14 days of quarantine? Because I think that's the step limiting process for any of us. It's not like you're going to go on a holiday and spend a month effectively in isolation at either end. From what they're currently doing with testing, do we believe there'll be something that'll be a quick test to know whether you do or don't?
I think that's quite plausible. Emirates are already have been trialing pre-flight testing on one of their routes. I mean, there's a lot of questions at the moment about which tests are the best tests and how well they've been validated, but all of that's being sorted out really, really quickly. And you could easily imagine some kind of immunity passport, or a proven, a bit like in your passport that you're COVID immune, or indeed, as you say, a point of care testing. I think that's inevitable down the line. Absolutely.
Okay, beautiful. And then anything further on vaccine? In the last week since we spoke?
Well, there are now close to 100 candidate vaccines in different stages of development. The most hopeful people are suggesting that there will be results from studies, early studies, phase 1, phase 2 studies in the next few months. Others are saying there's never been a vaccine to coronavirus yet, i.e. SARS and MERS. We haven't got a vaccine to HIV yet, despite hundreds of millions of dollars of development. So nothing concrete, and everything ranging from quite positive to very, very negative.
Okay.
Yeah.
All right, so I'm going to go to the other question. So as a parent, thanks, Joanne. As a parent, how can I feel okay about sending my child to school when around the world you hear of children dying from the virus?
Yeah.
And I think there's quite a few questions around children and going back to school, because obviously there's sort of mixed messages. The Prime Minister saying something, and then obviously state-based, we're getting different ones as well.
So I'd come at this a couple of ways. The first one would be, as we show in the number of cases in Australia, COVID is now almost eradicated. And so the chance of any child in Australia coming into contact with anybody with COVID is incredibly low. It just is. Look at the data. Yeah. Children do get COVID, but the levels of serious illness amongst children is incredibly small. So it's obviously an individual parent decision. If I had young children, I would definitely send them to school when the schools were open. Caveat would be whether I had elderly parents or grandparents in the house, because if you did, you'd have to think twice about aspects of that. But the risk to the child is minutely small in Australia at this time.
Excellent, thank you.
Yeah.
Next question from Andrew. As skin cancer doctors, and with our reliance on dermoscopy, how do you see telehealth playing a role for us?
Yeah, so I mean, I guess that the obvious sort of way into that is to think about it for giving results out and doing those kinds of consultations. I mean, clearly, you need to do a skin check for proper care of our patients, but results, even wound care, maybe, we could do that with telehealth. And again, I would just be saying that, again, the number of cases now is so incredibly low. We can be thinking that within the next couple of weeks, COVID is effectively eliminated in Australia, that actually the risk has kind of gone to us in our setting. And so what I would be doing is thinking again about, strict personal hygiene, washing hands, etc., and recognizing that the risk to us, because of all of this work that's been done, has effectively now gone.
Yeah, I mean, and just to share our experience, because obviously we've got 9 skin cancer practices, so we've just adapted a store and forward systems called EDEM that we've used in the UK years ago, so that patients can upload clinical images, obviously images on their smartphone securely to us. Because, I mean, obviously from a skin cancer perspective, we need a decent quality image. I mean, the patient holding their arm up with the webcam probably is not going to be very effective. But ultimately, if the patient's got to the point they've taken a photograph of something they're concerned about, I mean, pretty much 100 times out of 100, you're going to say, well, clearly it's a concern. It must be new or changing. You should come in and get your skin checked. So I think that really, and look, the other purpose we're using it for is for follow-up for non-surgical as well. So, Epidemics, et cetera, can be used for that purpose as well. So there's a few different variations of it. It is a little bit difficult, as you can appreciate. But the advantage by having images sent to us in advance, we can just pick up the telephone and talk to the patient. We don't actually have to use video conference, just as an example how we're doing it. And I'm happy to put something together and share it with everybody if that's of interest to them. Okay. So if there is asymptomatic transmission, do you think this is happening in Australia?
I think there is no doubt that it has happened in Australia. What reassures me that it's not a significant problem is the very high levels of testing that are being done in all states and territories in Australia. Now, of course, we all know that the testing has been biased towards people with symptoms, understandably, prioritization of resources. But the truth is that so many people have been tested now that if there was a significant prevalence of cases, then we would have picked up more asymptomatic people. The Doherty Institute has just started a major national seroprevalence survey. That'll give us really interesting information. So I think, yes, there almost certainly has been asymptomatic transmission. And that's why the social distancing has been so effective, by everybody just separating.
Okay, beautiful. After exposure, is there any way to prevent infection, e.g. inhaling hot steam from steamers with medication drops, iodine, or any other meds?
Nothing that I've seen that stacks up in any way. And I'd be tempted to say that that's actually probably a bit risky. You might cause more damage than might do more harm than good by trying any of that. So nothing that I've heard of.
Okay. Yeah. And for those asymptomatic from what those asymptomatic figures show us, yeah, does it follow that we can then group, let's say, skin cancer clinic appointments by age, and make a new model where such as an appointment distance from our patients? I suppose the key thing, it would be nice to be able to have age ranges to guide the initiative. So I suppose this is once again, yeah, future business models, assuming we don't have a solution.
So I think, I mean, it's a good question, Francis. And I mean, the way I think about this at the moment, right, recognizing that all of this is changing all the time, is I think it makes a lot of sense to do, a half-day clinic session or whatever for elderly or at-risk people. So that would be, anybody over 65, anybody over 60 with comorbid conditions, etc. The standard criteria that are out there, and have them come in under, if you like, enhanced social distancing, and it's for their protection, because I can imagine a situation, it may happen in Australia, where young people are allowed back out into the wild, if you will, and the economy restarts, but elderly people, who are the people at risk, being ultra protected. I think that if we continue the restrictions that we have now, we will have effective elimination in Australia. And so asymptomatic transmission, while we'll need to be conscious of it, won't be such a big deal, because the number of cases will be so tiny.
Yeah. Awesome. Can I get you to have a go at the next question, only because it's got a whole bunch of words in there, and I'm going to struggle.
So chloroquine, ivermectin, and azithromycin, and multiple other treatments. So, and there's another question about from Andrew on Gilead's antiviral resmedivir. So it's interesting because that antiviral is the one that everybody's really quite interested in. All of these treatments are currently in a range of different clinical trials all around the world. It's Gilead's antiviral that the gossip in the medical circles is that this could be the one, it could be the big one. They've got trials underway at the moment. Results will not be far away, and that could be quite significant. So I think it's a case of watch this space.
Awesome.
And then from Chris about PPE in general practice on a daily basis, if we're not testing patients for COVID, and Chris is right, there are definitely mixed messages out there. I mean, so again, my thinking would go a little bit like this, Chris. Depending on your on exactly where you're located, again, the number of cases now and the transmission that's going on is incredibly small, incredibly low numbers. So the risk is really low, number one. Number two, we know in medicine from all infectious diseases that if you are symptomatic, you are more infectious. We know that. We know that's the case. it's got to be the case in COVID. So the fact that there are symptomatic and asymptomatic people is kind of standard infectious diseases. The asymptomatic people certainly will be transmitting, but at lower rates. So I would be sort of segmenting my use of PPE by whatever I'm seeing the patient for, and whether the patient is symptomatic or not symptomatic. Linked to this, as we all know, is a real problem in general practice in Australia at the moment. The number of consultations has fallen, the number of face-to-face consultations has fallen, practice income has fallen. And we're going to hear more and more this week about restarting the health system in hospitals and primary care. So now that the cases have dropped right off, I think that, you know, the need for PPE beyond what we would normally do in general practice, if we're not testing patients for COVID, is basically running back towards what it was before.
I mean, but in this current point, can I just ask then, what would then you would use? I mean, is it just purely face mask, or only if you're in close proximity to the patient? I mean, really, what's the what would you wear?
I think there's no harm in using face mask, even now in general practice, for the next 2 to 3 weeks while all of this really does settle down. But again, as we said last week with the face mask update, if you're going to do that, you've got to use them properly. You can easily make it worse if you keep fiddling with the face mask. And then, you know, hand washing and keeping everywhere clean. It's back to those basics, to be honest.
Yeah, and I think reasonably, as we suggested before, the whole social distancing thing will be in for a little while.
Yeah.
And I think, unfortunately, Chris, we won't be watching Essendon play at the MCG in a hurry, which is going to be a bit disappointed. One of the other questions that you asked is obviously the copy of this webinar. So we do record these every week. We do send them out to everybody on tomorrow morning. So you will get a copy of this, and you're welcome to share it with family and friends. And I think also the information, whilst, you know, we're targeted towards medical professionals, typically is definitely, I think, general information. We're obviously, you know, believe that there's a lot of benefit in this information being shared further afield. So please share it with everybody. Hot and cold alternative sensations of body. Is this one of the symptoms of COVID?
I have not heard that. So my honest answer to that is I don't know, but I have not heard that. Okay. Yeah.
Beautiful. Cool. Now, if anyone's got any other final questions, that's the ones that I have here. But what I will do is, once again, is just thank David very much for his time, putting this aside. Thank you for everybody who's also attended the webinar today. We will be running this again on next Monday. We'll keep going, as I said, whilst there's still more information. And I think, once again, until we get past the hump, that I'm hopefully in the next few weeks, we'll see some of the relaxations of those measures. And just a reminder, on Thursday, once again, for those that are practice owners, we are running a series, and we've got an accountant coming in specifically this week. And then next week, we've got a special edition on domestic violence, which we've put together specifically for you next week. So, because as I said, we're, you know, one of the issues, obviously, where people have been stuck in the same house as each other. Some people don't love each other as much as they probably thought they did. And that's obviously an issue. And we've got some special education and training, which we're going to be rolling out next week for you for that. So, well, there's no other questions, David. So thank you very much for your time today. And thank everybody for your time, and look forward to seeing you next week.